Hi, my name is Dr. Terrence Baker, and welcome to the poster session of PBM 2021. Today, we're going to be hearing from over 30 poster sessions from 18 nations around the world. Leading world experts are going to teach us principles of PBM based on research, cutting-edge science, and clinical applications. I look forward to hearing from each of these presenters that represent the best of the best. Today, this poster session will stimulate thought, discussion, and further research. Without any further ado, I welcome you to the poster session PBM 2021. I'm your host, Dr. Terrence Baker.
Hello everyone, welcome to PBM 2021. This is Professor Chandrasekhar Yavgal joining you from Rajiv Gandhi University of Health Sciences, India. And today I'm here to present my poster on a comparative histological evaluation of the effects of laser photobiomodulation on dental pulp cells. So basically, I'm a pediatric dentist, and for pediatric dentists, pulpotomy is a very common treatment modality that is rendered in children. So it's a very big deal for us, and pulpotomy is the complete removal of the coronal portion of the dental pulp, followed by the placement of a suitable dressing or medicament that will promote healing and preserve the vitality of the tooth. This is more than 100-year-old science, ladies and gentlemen. Unfortunately, for more than 100 years, we have been subjecting tiny innocent children to certain harsh pharmaceutical pulpotomy medicaments such as phomocristol. Why do I say that? They are harsh, caustic agents because their carcinogenic and mutagenic potentials have always been questioned. So, for far too long, we have been searching for the holy grail as well as far as pulpotomy in children is considered. Slowly but surely, because of photobiomodulation, we seem to be moving from a pharmaceutical era to a photoceutical era. So this is the first intervention of its kind where we have tried to accomplish pulpotomy by using a non-pharmaceutical fixative or a non-pharmaceutical agent, which is light. So how did we plan this trial? This trial, as you can see on the left hand side of the poster, was divided into 3 phases. We did the first histological evaluation as an animal trial. Then, based on the encouraging results that we got, we did a human clinical trial and also followed up by a radiographic evaluation of those human pulpotomies done on children. So in the first method, we did the histological evaluation and we got very good results. You can see on the screen that when you compare laser photobiomodulation with phomocristol, the laser group has
dental bleaching using violet light, a new perspective for aesthetic dentistry. The authors are Panhoca, VH, Rastelli, ANS, and Bagnato, VS. A beautiful white smile has been considered a symbol of beauty, health, and vitality for hundreds of years. The teeth discoloration, especially when of the front teeth, means a significant disturbance of aesthetic and may decrease a patient's self-esteem. Dental bleaching offers a conservative, simplified, and low-cost approach to change the color of discolored teeth. The techniques used in the dental practice, also called in office bleach or used in the dental practice, also called in office bleaching for assisted technique, have been widely used, consisting of the amplification of high concentration bleaching agents such as carbamide and hydrogen peroxide, which are without the use of the light source. The main advantage of this technique lies in the significant aesthetic results achieved in some sessions. Despite the demonstrated effectiveness, bleaching agents used in high concentrations can cause two changes in the mineralized tissues and other side effects, such as sensitive and transpostoperative sensitive. Thus, the development and introduction of new products and techniques for tooth bleaching that do not promote changes in the mineralized tissues and side effects has fundamental importance because it is a procedure routinely used in dental office. Objective. Then the purpose of this study was to demonstrate through clinical case report a new dental bleaching technique using a light source capable of breaking the pigments responsible for the dental darkening. The case report is this. A 31 years old female patient, MCM, reported to the clinic of Department of Restorative Dentistry at School of Dentistry Araraquara, UNESP, com a complaint of teeth discoloration. In the figure 1, we can see in A, right side view, and B, front view of the case, and C, left side view. In figure 2, we can color measurements with using Vitaplan Classical. In figure 3, we can color measurement using a spectrophotometer Vita Easy Shade.
Greetings, I'm Dr. Rhythm, professor in the Department of Conservative Dentistry and Endodontics in King George's Medical University, Lucknow, India. Photobiomodulation therapy is defined as a form of light therapy with lasers in the red and near infrared, that is 600 to 1100 nanometers optical window of the electromagnetic spectrum. It is a non-thermal process involving endogenous chromophores eliciting photophysical and photochemical events at various biological levels. The aim of this poster is to comprehensively present the myriad uses of photobiomodulation in oral health care and improving oral health-related quality of life and illustrate a few cases treated with PBM. PBM offers remarkable applications in modern dentistry, namely restorative dentistry, periodontology, wound healing, temporomandibular joint disorders, management of post-endodontic treatment pain, enhancement of the depth of anesthesia, and soft tissue treatment, to name a few. Early diagnosis of dental caries is a major challenge and is critical to reduce the global burden of dental restorative needs. Currently, laser wavelengths of 488 nanometers and 665 nanometers give promising results in this regard. More recently, several studies have shown that PBM is effective in relieving symptoms of oral mucositis and ulcerations in head and neck cancer patients undergoing chemo and radiotherapy. Keeping in view the opioid dependency crisis, a simple, safe, and effective non-invasive pain therapy like PBM could significantly reduce the dependence on oral opioid-containing medications. Now, a few cases which I have done with the help of photobiomodulation. First case was of antibioma, which is a hard swelling which developed in a 15-year-old male patient due to prolonged and non-judicious use of antibiotics and non-debridement of the source of infection, that was the right mandibular first molar. So the patient presented with a hard swelling on the right side of the face. The X-ray showed a periapical lesion in relation to tooth number 46. The treatment was planned to do was root canal treatment of the tooth number 46 along with the use of PBM to relieve the symptoms of swelling. So wavelength of 1064 nanometers, that is the Nd:YAG wavelength, from a flat top handpiece of 0.5 milliwatt power output, 10 Hertz, and in the MSP mode for 60 seconds per centimeter square was given at the site of the swelling for the day 1, 3, 5, and 7. After 20 days, we could see a remarkable reduction in the swelling. So we can say that photobiomodulation is emerging as a powerful therapeutic adjunct in various fields of dentistry. Thank you.
Thank you. Okay, so I'm presenting here from Melbourne in Australia, an actual COVID lockdown at the moment, but we're presenting a case, a case of patients that we saw at Sydney Adventist Hospital during the 2020 COVID lockdown, actually. And so this was a study where we were looking at the benefits of photobiomodulation therapy in the management of oral mucositis for patients undergoing high-dose head and neck radiotherapy. So the patients were selected if they were at high-dose head and neck radiation therapy and at high risk of contracting oral mucositis. The patients had to receive at least 50 grays. And the reason why we chose these patients was because we knew that, looking at the current literature, that 80 to 100% of these patients would actually experience grade 3 to grade 4 using the World Health Organization mucositis scale, so severe mucositis, which is why these patients were selected. The trial was firstly initiated as a randomized control trial, but due to the COVID restrictions and due to the inability to have control patients and to try and reduce the risk of the spread of the virus, we had to change it to a COVID-safe protocol. And so it was a single-arm trial, and that's why we moved to just using the high-risk patients, because we knew that they would experience mucositis. One of the patients, or the first patient was actually employed in the study, was undergoing radiation therapy at 70 gray, which is the maximum head and neck radiation dose here in Australia, for nasopharyngeal carcinoma, which is at a very high risk of receiving oral mucositis. It was also having chemotherapy as well, which puts him at an even higher risk as well. The patient, interestingly, had a brother who underwent the exact same treatment for the exact same cancer only 10 years earlier. And that brother, actually experienced very, very severe oral mucositis of stage 4 using the WHO mucositis scale. He was also had to be tube fed and required high doses of paracetamol. In discussion and talking with the brother, he still has issues following the radiation therapy and even some neuropathic pain. And he claims it was one of the worst things that he had ever experienced. And it was definitely the worst part of his whole cancer experience. So when we treated the brother, we actually wrote up a twin study paper, and that's the abstract for this WALT guidelines. And we started treating the brother prophylactically. So we treated him within 24 hours before starting radiation therapy. And the patient went quite well. So he was planned to have a G tube or a feeding tube placed at 2 weeks. We managed to avoid that because he had no mucositis by week 2. He was also planned to have high-dose opioids and even including possible fentanyl patches. But fortunately, throughout the whole treatment, the patient only required 3 500 milligram paracetamol tablets. The only area where he really experienced ulcerations, and of those ulcerations, they were considered to be of mild, using the WHO guidelines, so of 1 to 2, were the back of the throat. And that's just where we had found it difficult to apply the laser. We then started to get the laser further back there, and that throat actually became quite a lot more comfortable for that patient.
Hello, my name is Cássia Fukuda from Brazil, from All Laser, and we're going to talk about the use of low-intensity laser therapy in the treatment of a traumatic injury in the cranial region, in the skull region. So this work presents a case of a male patient, 42-year-old, with a history of surgical intervention in a lesion located in the cranial region, measuring approximately 18 by 11.5 centimeters. As you can see here in this picture, the 3 pictures, you have the follow-up of this case with a session 1 of laser, then the session 13, and finally session 25. So for the treatment of this lesion, we used photodynamic therapy with a device that's called the Lindsay from Mimiotics with wavelength of 660 nanometers. And the appointments were carried initially 3 times a week. And for the dressing of and coverage of these lesions, we used petrolatum on the bone and also other things to help this wound healing. And also what we see here, we did 25 sessions and the patient achieved significant results. And as a result, we can see that the lesions were totally healed and epithelialized after photobiomodulation sessions. It was possible to observe a significant improvement in the individual's general condition concerning the absence of pain as well as epithelialization of the exposed bone, which is a very difficult area to epithelialize. And as conclusion, we can see that this case report demonstrates the importance of using technologies, of using laser photobiomodulation combined with appropriate topical care for the treatment of wounds resulting from this kind of mechanical accidents. Furthermore, it's worth emphasizing the need of studies that take in account the best therapeutic options of these complex wounds and aiming healing, functional recovery of the affected limb. Above all, laser promoted here a complete healing and an improvement of the patient's quality of life. Thank you very much for your attention.
This retrospective study, patient files from January to December 2018 were reviewed after receiving independent IRB approval. Inclusion and exclusion criteria are detailed here. Following a history and physical examination and prior to undergoing any treatment, the post-injury test 1 program of the IMPACT test system was administered to each patient. After testing, patients underwent photobiomodulation using the BioFlex Duo plus laser therapy system that uses a 180 light emitting diode array set followed by laser probes. Both delivery methods were applied using placements to the cervical spine and the cranial areas, and both entailed the use of red light at 660 nanometers wavelength and near infrared light at 825 to 840 nanometers wavelength. Treatment was provided 3 times per week on alternating days with weekends off for 4 weeks for a total of 12 treatments using a gradually adjusted dosing scale, where an increasing power dosage and or modulation is applied every week per the schedule adopted in Table 1. Patients are treated and tested in the same darkened room free of noise interruptions and monitored by one physician. At the end of the 12 weeks, all patients took a second IMPACT test, the post-injury 2 test, and the results were compared to the post-injury 1. Clinically, all patients' conditions were improved after 12 treatments. 35 patients were found eligible for this retrospective review. We used a paired t-test, and the Wilcoxon sign rank test was used to calculate the difference between the pre-intervention and post-intervention, and patient post-injury 2 IMPACT test results were significantly better at 95% confidence level compared to their post-injury 1 IMPACT test results. The IMPACT test prior to 2021 yielded 5 composite domain scores covering objective verbal visual memory, visual motor skills, reaction time, and the cognitive efficiency index, and a subjective symptom score. The IMPACT post-concussion subjective symptom rating scale contained 22 somatic, affective, sleep, and cognitive symptoms, with each symptom being rated from 0 to 6. 2 values can be computed for the symptom questionnaire, total symptom score, and the number of symptoms endorsed as being present. Both of these values were examined for the study. The cognitive efficiency index is calculated based on both speed and accuracy of items clicked correctly. The IMPACT test has just been removed, the CEI in its newest streamlined version 4 format released in 2021, and has replaced this with a 2-factor score. However, given the significance of this measure at the 95% confidence level, we have decided to still include the CEI in the results as a report of its utility. To conclude, our study has shown that PBMT is an effective treatment modality for neurological rehabilitation in patients with post-concussive symptoms, as assessed using the IMPACT test, leading to improved cognitive performance and an improvement in symptomatology. PBMT should be considered one of the available options in the treatment of concussions and the persistent post-concussive symptoms. Limitations to the study included a small sample size and the treatment limited to 1 month. In our clinical practice, further improvement was noted beyond the 1-month period, and some patients had decided to continue treatment at home utilizing portable personal devices.
Photobiomodulation has been very helpful to this young patient. It helped her to get a better quality of Photobiomodulation has been very helpful to this young patient. It helped her to get a better quality of life and also to help her to recover from her severe MS symptoms, mostly tiredness and anxiety. For this, we've been using a lot of laser punctures. Besides these treatments showed on the posters. You know, this over here, we are at the hospital, and we do a lot of photobiomodulation for central catheter pain, and also for cicatrization when the catheter was get out. And over here to treat with APDT to ears fungus is really good. And for neck pain also, we use it a lot for sore throat, for nails that was really weakening. And every day, sorry.
Mais um. Isso.
Sorry, may I restart? Okay. And here, when we are mostly at the hospital, is really important. Here, she had been using eLib almost every day to help her with fatigue, and was really good. And we also using by alopecia, back muscles pain, APT for nail fungus, and she's really good. This was really important, mostly when she was hospitalized for the plasma exchange, pulsotherapy, and immunoglobulin treatments. So we are really excited and happy for the improvement of this patient. Mostly myself, because it's my daughter, and we are really helpful for the possibility to use the photobiomodulation, and for me to be laser therapy, and also dentistry that treat a lot of people here in Brazil.
Photobiomodulation, adjunct to intracerebral hemorrhage, a case report. Photobiomodulation, or PBM, came to light as an adjunct therapy to different diseases just this recent years. It has shown great promise with different neurologic diseases like Alzheimer, dementia, Parkinson, traumatic brain injury, and stroke. PBM has shown potential in acute stroke patients. Several studies on thromboembolic stroke were presented, but none yet involving acute intracerebral bleed. This is a case of a 58-year-old presenting with a headache, hypertension, left-sided focal neurologic deficit, manifested as right arm and right lower limb weakness with a 0/5 on manual muscle testing. The CT scan showed an intraparenchymal hemorrhage of the left parietal and posterior frontal lobes with a total volume of approximately 16 cc and a linear encephalomalacia of the right capsule, representing an old infarct. PBM was then started within 24 hours of the event. After 2 treatment sessions, she was able to raise her hand and walk without assistance. Headache, hypertension were also resolved after 2 to 3 weeks. On continued protocol for about 3 months, she was able to regain completely the mobility of the right arm and right lower leg. The repeat CT scan showed an interval resolution of an intracerebral hemorrhage of the left parietal and frontal lobes. The chronic infarct, although on the right capsule, was still noted. Patient had follow-up treatment sessions once every 2 weeks and monthly thereafter. Patient definitely improved. PBM, in conclusion, is an unchap in an intracerebral hemorrhage, acute, which was alleviated in this case. Future cases of similar nature may benefit from PBM. The end.
Hi, my name is Ana Paula Samways. I'm from Brazil, and I'm here today to talk about two clinical cases from COVID-21. Photobiomodulation had really good results in increasing this immune system of both these patients, preventing more severe complications and also to get fewer sequels after COVID. The immunologist was really impressed in how both these patients recovered were very well because of their age and comorbidities, and also comparing them to other family members. As you see here, COVID got this family of 20 people we have over here, and COVID arrived, and 9 ones take it the COVID. These two patients over here, who are oldest, presented fewer symptoms. Photobiomodulation is really good for them. As we can see over here, we had 9 cases, all of them with comorbidities, but the most severe or the most important for us was these two, because is the oldest people, and they have more comorbidities. At this screen, you can see the age of them is higher between the other ones, and they would really well. He don't present some severe problems after COVID also, and they use it to do before eyelid therapy, and during the COVID process, they do 3 times 1 hour per every day for like 20 days. So these patients were really good, and we are really impressed and really happy with their improvement. And the improvement of the case was really impressive for us, and also for the immunologists was with them during the COVID period.
My name is Marianne Degerman. I'm working in the municipality home healthcare department in Skellefteå in the north of Sweden. We're currently working with a scientific study on PBM on hard-to-heal ulcers in frail elderly patients. Hard-to-heal ulcers are defined as 6 weeks or older, and pressure ulcers are defined as hard to heal directly when they occur. We have treated 55 ulcers, and we found that 50% of them healed in 7 weeks and 80% healed in 11 weeks. As you can see in the diagram below, as the blue bar is the ulcer duration before PBM, and the red bar is the number of weeks with PBM until healing. We found a poor correlation between the ulcer duration before PBM and the PBM treatment period necessary to heal the ulcer. This is a very important finding, as the accepted view in traditional ulcer treatment is that the longer the ulcer duration, the less probability of healing, which this speaks against. We also had savings during the PBM treatment. The most important one, of course, is the patient suffering. but we also had a 77% reduction of dressing material costs and 248 label hours saved during the changes from active dressing to basic materials, and the less need of dressing change on the ulcers. We used red light on the ulcer edges and on the ulcer surface, and we used infrared lights on the lymphatic areas and the ulcer surface, as you can see the application points in the figure. Then I would also like to share with you a sunshine story. We have the photographs of a heel up here. This patient was born 1927 and was too frail for amputation. He had a severe arterial insufficiency and a pressure ulcer on the heel. We started the treatment not to heal this ulcer, but to try to slow down the progress of the ulcer. But it healed, and the patient is still alive after 1 year.
Ana Paula Ferro. I am a part of the Dermatofunctional Assessment and Intervention Laboratory from University of São Paulo, Brazil. My project is financed by FAPESP, and it's about influence of different photobiomodulation parameter on multipotent adipose tissue mesenchymal cells. The association of therapeutic resources involving mesenchymal stem cell and photobiomodulation identify as a promising in the tissue healing process. However, the parameters used to associate with biological mechanisms are not fully established. Stimulations depend on photobiomodulation-related parameters such as wavelength, energy, power, irradiation time, and the type of irradiation cells. Thus, the aim of this project is to investigate the effect of different photobiomodulation parameters on adipose-derived multipotent mesenchymal stem cells. These study methods consist in a radiation of mesenchymal stem cells with a wavelength of 660 and 830 nanometer, power of 40 and 100 milliwatts, and the energy of 0.5 to and 4 joules. The coordinate image of the poster, the wells contain cells were interspersed with empty wells because we need to prevent the light from interfering with the other wells. The design of the study consists in the trypsinization and the plate cells. In the day one, it's the trypsinization and the plate cells. In the day two, the radiation on the 3 plates. In the day 3, have a irradiation and the analysis of the plate 1. In the day 4, have the irradiation and analyzing the plate 2.
Hello, my name is Cássia Fukuda from Brazil, from All Laser, and here we are presenting a case of the use of photobiomodulation in a patient care with multiple injuries in a favela in the city of Rio de Janeiro. So we have here a patient of 73 years old, resident in Rio de Janeiro. He had various sequelae from stroke, bedridden, partial loss of skull cap, and also metallic prostheses, as you can see in the picture, due to a fall from his own height. So he was discharged from the hospital, and he had 18 lesions all over his body. And the most extensive lesion was in the left trochanter, approximately 26 centimeters by 18 centimeters of length. And there was signs of infections in strong odors. And also, during this session, we used dressing sessions with the use of 15 minutes of ELIP at the wrist, at the P9 point here, a lung 9, using 15 minutes. And also we use all over the wound 1 joule of red and 1 joule of infrared laser together. And we use also the antimicrobial technique, photodynamic therapy, with conjunction of the red laser and methylene blue. Also, we had all these lesions that were irregular, of death with presence of necrosis, all of them healed and epithelialized after the photobiomodulation. So it's possible to observe a significant improvement in the individual's general conditions also. He began eating, he began bathing without aid, and improvement of 70% of generalized joint stiffness, quality of sleep, and above all, the absence of pain throughout his body. So you can see all the follow-up of the pictures here from September until May, and the nurse, Vanessa Coeli, that did all the work. And in conclusion, we conclude that laser is an adjunctive treatment with action capable of accelerating the healing process of the tissue injury. And this was promoted improvement in the patient's general condition, resulting in their well-being and quality of life of this low-income society of Rio de Janeiro, Brazil. Thank you so much.
Critical limb ischemia risk factors consist of age, hypertension, smoking, dyslipidemia, obesity, sedentary lifestyle, family history of atherosclerosis or claudication, and diabetes. Standard intervention for CLI may include modifying the risk factors, wound debridement, revascularization, and amputation as the last option. CLI is often seen among diabetics, and in 2019, there were about 463 million worldwide. Diabetes leads to vascular complications like peripheral artery disease or PAD. PAD affects about 19% of diabetics, which progresses towards CLI. This converts to about 88 million poor souls at risk of limb amputation. The concept of photobiomodulation to increase cell metabolism and repair has been studied for some time. In fact, there were several reports on the use of the technology for wound healing among diabetics, but none on its effect on preventing limb amputations. In the past 17 years, and among 1,446 diabetic patients, we were able to include 123 subjects with CLI that were advised major leg amputation. The youngest was 23 and the oldest was 95 years old. 91 subjects completed the treatment while 32 were non-compliant. The subjects were followed up for 6 months to determine the endpoint of amputation or death. Among the compliant group, 79 subjects did not undergo major amputation, while no one avoided a major amputation in the non-compliant group. 12 among the compliant group had major amputation, while all in the non-compliant group had a major amputation or died. The compliant group underwent 15 to 45 PBM exposures, while the non-compliant subjects are those who had less than 3 interventions. Observations. In the limb loss cases, a knee-level surgery was done. There was extensive bone involvement. Sepsis played a factor, and there were comorbid diseases like CKD, heart failure, and COPD. In the limb salvage cases, a knee-level amputation was prevented, and sometimes we salvaged the whole limb. In conclusion, completed adjunct photobiomodulation in critical limb ischemia subjects prevented a knee-level amputation or death in this case series. This implies that adjunct PBM has the potential to prevent major limb amputations for millions of our diabetic fellow men. Thank you.
Hi, my name is Steve Liu. I'm a licensed acupuncturist from Tucson, Arizona. and also the co-chair for the laser acupuncture session in PBM 2021. And this is one of my two presentations. The first one is the podium, and this is one is for the poster. And this is the title is Integrative Treatment for Peripheral Neuropathy. In the last 20 years, I have been practicing in Tucson, Arizona. I have seen tremendous growth in terms of peripheral neuropathy patients. And peripheral neuropathy is the medical term used to describe damage to the peripheral nerves and the disease suffered by over 20 million Americans. And we heard a lot about diabetic peripheral neuropathy, and I'll talk in a little bit too. And this actually, diabetic neuropathy, in my opinion, in my clinic, totally can be controlled by lifestyle changes. But we'll talk about the photobiomodulation first. Of course, I'm an acupuncturist, but I'm also laser acupuncturist. I use a lot of lasers. So the PBM is very important in terms of treating peripheral neuropathy because a 2017 study, they found exposing injured nerve tissues to red light therapy can accelerate the regeneration process. And also in another 2018 systemic review, they found that PBMT, photobiomodulation therapy, can improve the electrical properties of the treated tissue, nerve tissues, decrease inflammation and alleviate pain. Because of these properties, the rejuvenation properties and the anti-inflammatory properties of the PBMT for nerves, and I absolutely love to use that in conjunction with the acupuncture. Now, for my acupuncturist colleague, when you are watching this presentation, make sure include this PBMT and learn something from the conference and get a system. And you can definitely reach me. My email is down in the bottom. And as you can see from the photos, and these lights, red lights, I just use the red lights for the toes because most patients complain the numbness, tingling, and pain in the toes and the balls of the feet. So on the balls of the feet, I use infrared and infrared wavelengths, somewhere around like 810, 830 nanometers. But on the toes, I definitely use a red light, and this is about 650, 680 nanometers. I use on the every toes and on the balls of the feet with the infrared. And definitely include the lifestyle modifications. So this is what I mentioned about using diabetic neuropathy, and then you can use, and according to a Danish study, people using statins that can cause a peripheral neuropathy. So you want definitely help patients get off the statin.
My name is Carlos Eduardo Girassol. I'm a PhD candidate at the University of São Paulo, Brazil, and supervised by the Professor Reinaldo Gui. The work represented today is titled The Incremental Dose of Photobiomodulation in Muscle Performance, a randomized controlled trial. The actual literature presents a lack for the physical parameters, the better definitions for physical parameters at the wavelength, power, energy density, and different dose or incremental dose for muscle performance in the interaction of muscle tissues. For this reason, the aim of our study is evaluate the chronic effects of the application of PBM on the strength capabilities and fatigue resistance of healthy individuals. For that, we imposed a method with 3 times of evaluation composed by the bioimpedance for body composition and the dynamical isocinetic. The volunteers are exposed for 5 weeks of training sessions in a PBM. The protocol was composed by the squat and the stiff leg exercise with a previously applied the photobiomodulation. Photobiomodulation was performed with a blanket composed by the 108 infrared lights with a total power at 1.08 watts. 4 groups was imposed: the minimal energy proposed by the literature, the maximal dose proposed by the literature, and the third group with an incremental dose when they begin with a minimal dose and let's finish with a maximal dose in the last session frame. The fourth group is a group sham. For this method, we not observe different results between the groups. Whatever for the external load, the skeletal muscle mass for the bioimpedance, the initial fatigue, and the peak of the torque. For this reason, we conclude that PBM does not promote superior results to sham for body composition and the isokinetic assessment indexes after a 5-week training protocol. I would so say thank you for the São Paulo Research Foundation and say thank you to the edit. Thank you.
Short-term effects of combination of photobiomodulation therapy and magnetic field in chronic neck and shoulder pain, a randomized placebo-controlled and triple-blind clinical trial. Neck pain and shoulder is a widespread health problem with significant economic impact and decreased quality of life. Randomized placebo-controlled study, triple-blind clinical trial was to determine the combined effect of photobiomodulation therapy and static magnetic field, PBMT, SMF, in the management of chronic pain in the neck and shoulder. 72 patients with chronic no-specific neck and shoulder pain were randomized allocation in 2 groups, active and placebo. PBMT, SMF for 6 total treatments twice weekly and the lab. The photobiomodulation therapy and static magnetic field with a dose of 30 joules or placebo per location delivered by a cluster of 12 joules, 4 of 905 nanometers lasers, 4 of 875 nanometers LEDs, 4 of 640 nanometers LEDs, and the static magnetic field of 35 meters. To 9 sites in the neck and shoulder regions, assessment of pain intensity VAS, range of emotions, subjection, and satisfaction with the treatment and daily medication used was assessed its baseline, 15 minutes, 24, 48, 72 hours post-intervention, and 7 days post-treatment conclusion. The active group demonstrated a significant decrease of pain intensity and a change of 27%. There was no statistical difference in the secondary outcomes measured in outcomes based on skin phenotype. No adverse events were observed. Figure 1 was change, neck and shoulder intensity, baseline endpoint, 24 hours post, 48 hours post, 72 hours post, 7 days post. Laser points. Conclusion, the photobiomodulation therapy and static magnetic field significantly reducing the intensity of chronic neck and shoulder pain. Thanks, LAPT, CAPS, Multi-Regions Medical e Universidade 9 de Julho.
Hello everyone, I am Adeilson Matias and I'm going to present you this work. Can photobiomodulation therapy be an alternative to pharmacological therapies in decreasing the progression of skeletal muscle impairments of MDX mice? Duchenne muscular dystrophy is a lethal disease caused by absence of dystrophin. The preclinical model widely used to study this disease is MDX mice for the total lack of dystrophin protein expression. It's very important to study alternative therapies with high efficacy in reducing DMD symptoms without undesirable effects. And photobiomodulation has been showing positive results in delaying skeletal muscle fatigue in animals and humans, improving biochemical markers related to skeletal muscle recovery. This study aims to analyze the effects of photobiomodulation and pharmacological therapy as isolated or combined treatments in dystrophin through immunohistochemistry, as well as to analyze the morphology and muscular function of MDX mice. The animals were randomized and divided into 7 groups: wild type, placebo, photobiomodulation, glucocorticoids, non-steroidal anti-inflammatory drugs, photobiomodulation plus glucocorticoids, and photobiomodulation plus non-steroid anti-inflammatory drugs for 40 weeks. For the photobiomodulation, was used a cluster with 9 diodes with a dose of 10 joules and radiation time of 77 seconds per site at the central point of the tibialis inferior muscle, 3 times a week. About the results, treatments involving glucocorticoids and photobiomodulation were effective in preserving muscular morphology. All groups treatments with photobiomodulation increased surfing gene expression compared to placebo group. However, in the functional performance, photobiomodulation presented better results compared to glucocorticoids. In contrast, the use of non-steroidal anti-inflammatory drugs did not appear to add benefits to skeletal muscle tissue. We believe that the optimistic results about photobiomodulation in MDX mice may in the future contribute to this therapy to be considered a safe alternative on Duchenne muscular dystrophy in the washout periods, allowing them to remain receiving effective and safe treatment, avoiding at this way periods without administration of any treatment. I would like to thank you, the CAPES, Uninove, LAPIT, and Mood for representing this work at this Congress. I am glad and grateful for this opportunity. Thank you very much.
My friend, it's a pleasure to present you the communication of my young student, Sarah Git, from the University Diploma for PBM in France, about the effects of photobiomodulation in cancer-related lymphedema, a review of the literature. Lymphedema is a potentially serious complication of treatment for patients with breast, head and neck cancer, gynecologic or genitourinary cancer. Numerous therapeutic options are present, but few are efficient, like including compression garments, complex decongestive physiotherapy, manual lymphatic drainage. And so a PBM should be a very interesting way to treat these very important side effects. We have several other literature review, but we did a new one with a new parameters now we have in PBM, and that's a very brand new way to analyze the different literature and showing really the difference in parameters, protocols, and that's certainly the good way now to analyze results. So for this literature review, we had several important studies you are shown here with different wavelengths, different power, and different protocols. And for all of them, we examine arm circumference, arm volume, grip strength, pain score after PBM, with or without PBM, with the different dose and the different parameters we have for these different studies. For example, studies from Maya and colleagues from India was a very nice study, but we missed some important parameters and it was difficult to analyze every parameters coming from this study, but it was a very interesting study for pain score and for arm circumference. So finally, when we look at all these different studies in this literature review, we can say that the efficacy of PBM in the management of cancer therapy-induced lymphedema should be very high, and we have very interesting studies, but new trials are really needed to clear up some uncertainties regarding the lack of consistency between the laser parameters that are used. So our message today is to homogenize all our protocols in all the use of PBM, especially for physiotherapy and for lymphedema. So it will be much easier to compare the different studies and really to appreciate the real effect of PBM in such a situation, here lymphedema. there is no doubt that PBM is really efficient for lymphedema, but we have to define all together the best protocol, the best parameters to use to really use PBM in the mainstream medicine now, with the complete known parameters that we have to use in the different situation.
Hello, thank you for offering me this chance to share with you my study protocol for a prospective interventional pilot study. The title of this study is Management of Long-Term Radiation Side Effects of Head and Neck Cancer Survivors Using Photobiomodulation Therapy. My name is Dr. Vincent Leung. Myself and my research team comes from the Hong Kong Polytechnic University in Hong Kong. The focus of this study will be on nasopharyngeal carcinoma patients, NPC. It is the most common head and neck cancer in Hong Kong, with approximately 850 cases per year. All NPC patients receive radiotherapy as their radical treatment. It involves an extra high dose, as high as 70 gray, and a very extensive treatment volume from the base of skull all the way down to the entire neck for the prophylactic neck lymph node irradiation. Thanks to the technological advancement, such as the IMRT over the past decade, the disease control and overall survival for NPC patients has been improving. However, this also means that a substantial amount of NPC survivors are there that needs our attention. Because as I've talked before, the radiotherapy of NPC involves a very high dose, a very large volume. The survivors will face a lot of different kinds of long-term radiation side effects. A study suggests that xerostomia, dysphagia, and trismus are three major long-term radiation-induced side effects that directly impact the major unmet quality of life needs of NPC survivors. Photobiomodulation therapy has been suggested by the MACSCC to treat acute oral mucositis in radiotherapy patients. Recent evidence has also been suggesting that the severity of chronic conditions can be alleviated by PBMT. However, we also noticed that PBMT published data for chronic radiation side effects is still sparse. Therefore, there is a need to conduct this study to demonstrate the efficacy of PBMT in this aspect. The aim of this study is to investigate the effect of PBMT in mitigating the severity of radiation side effects and its lasting duration in NPC survivors. The quality of life of the recruited subjects will also be evaluated. This will be a prospective single-arm pilot study. The subjects will be recruited from 4 hospitals in Hong Kong. All recruited subjects will receive PBMT in our campus in the Polytechnic University. The sample size will be approximately 130. This is based on a similar study on the management of xerostomia of head and neck post-RT patients using PBMT.
A pleasure to be here and share our experience with you. Patients who will undergo bone marrow transplantation to avoid systemic infections caused by oral bacteria must undergo prior oral preparation with removal of all infection foci. However, many of these patients use Zometa, which predisposes to the onset of osteonecrosis, especially in patients undergoing tooth extractions. This work aims to present the effects of photobiomodulation in preventing osteonecrosis in 2 patients with multiple myeloma who used Zometa and who had to undergo extraction prior to bone marrow transplantation. The PBM protocol performed was this, as you can see in the poster. The application were performed daily for 3 days after tooth extraction and 3 times a week for the following 2 weeks, plus 15 sections performed together with oral mucositis prevention care, totaling 24 applications. Both patients had no complications during and after bone marrow transplantation. The tissue healing in the regions of the extraction occur without osteonecrosis. PBM has been shown to be an effective therapy in the prevention of osteonecrosis in patients using Zometa, and it can be an excellent solution for patients who will undergo bone marrow transplantation and need dental extractions before treatment.
Ana Elisa, I'm PhD student at the University of São Paulo, and I'm presenting to you my abstract about photobiomodulation and oxidative stress. The aims of this study were, first, to compare the consecutive or simultaneous radiation used two wavelengths, 660 nanometers and 808 nanometers, with radiation use one wavelength in relation to reactive oxygen species, or ROS production, and stimulation of the antioxidative system. Second, to investigate the oxidative stress patterns in gingival epithelial cells and fibroblasts exposed to these different laser radiation parameters. For this project, we used primary human gingival epithelial cells, and fibroblasts were subject to the following conditions: control group, red group, infrared group, consecutive group, and simultaneous group. In all the groups, the laser parameters were diode laser with 100 milliwatts with 0.09 square centimeters spot area. In each group, the irradiation times were 6, 10, and 20 seconds. The ROS production and the superoxide dismutase, or SOD activation, were established for each experimental situation. At the time, the 6 and 10 seconds irradiation, epithelial cells produced significantly more ROS and activated more SOD than fibroblasts. At the 20 seconds irradiation, the simultaneous group led more ROS production and SOD activation in fibroblasts than in epithelial cells. In the epithelial cells culture, the infrared group at the time 6 and 20 seconds irradiation showed the highest ROS production and SOD activation. Gingival epithelial cells tend to show a more pronounced oxidative stress than in gingival fibroblasts, mainly after infrared radiation exposure. The consecutive and simultaneous radiations improve significantly the oxidative stress in fibroblasts. The development of clinical laser radiation protocols using combined wavelengths must consider the different oxidative stress modulation in epithelial and connective tissues of the oral mucosa. Thank you, everyone.
Hi, my name is Flavia. I'm postdoctoral researcher at University of São Paulo, and today I'm going to present this study, Effects of Photobiomodulation Therapy on DNA Damage in 5FU Treated Gingival Fibroblasts and In Vitro Study. The aim of this study was to evaluate the effects of photobiomodulation, or PBM, on DNA fragmentation and repair on oxidative stress in gingival fibroblasts previously exposed to 5FU. Cells were treated for 24 hours with 5FU, then the cells were exposed to PBM. The assays analyzed were MTS assay, COMET assay, gamma H2AX and P53 expression, superoxide dismutase or SOD activity, and MJ expression. The analyzed groups were control group, cells treated with GMSO, 5FU group, and PBM groups with 6, 10, and 20 seconds. As a result, in the first graph, we analyze cell viability after 24, 48, and 72 hours of exposure to 5-FU. After 24 hours of exposure, cell viability was about 54% compared to the control group. In the second graph, we analyze cell viability 24 hours after PBM. The 5-FU 10 seconds show the highest viability in relation to 5-FU and 5-FU 6 seconds. In the COMET assay, 5-FU showed a higher tail DNA percent compared to control group. Besides, the tail DNA percent was higher in the 5-FU 10 seconds. Gamma H2AX and P53 expression in the 5-FU group was higher than all the groups. When the 5-FU treated cells were exposed to PBM, gamma H2AX expression was lower as the radiation time increased. Regarding P53, 5-FU 10 seconds showed lower P53 expression compared to 5-FU 6 and 20 seconds. 5-FU showed higher SOD activity and MJ expression than the control group. 5-FU 6 seconds showed the highest SOD activity. MJ expression decreased when the 5-FU treated cells irradiate for 6 and 20 seconds.
Good afternoon, and my name is Marina Lua. I am a dentist from Brazil, and today I'm gonna discuss about my work, which is entitled Photobiomodulation versus Classical Pharmacological Studies. Should they be the same? So, despite advances in the dissemination of studies involving photobiomodulation, and it is still difficult to prove in the medical scientific community that PBM really works, because sometimes in many in vitro and animal studies we can prove it, but when it comes to clinical trials, randomized clinical trials, we have some difficulties too. And this is what we will discuss here. We're trying to evaluate the main difference between clinical studies and photobiomodulation and classical pharmacological studies, and trying to list this, the main difference and difficulties. Because sometimes we are using the same methods to compare the mechanisms of actions of light and drugs at the same time, and this does not seem to be adequate. So we're going to discuss 4 main points. That is the difficulty in photobiomodulation studies to standardize the sample, because sometimes we have difficulties about phototypes and endogenous chromophores, and this is not usual on classical pharmacological studies. And also the systemic effects that happens on photobiomodulation studies, no matter where you irradiate. And sometimes in classical pharmacological studies, there are already defined methodologies to study how is the dynamics of this drug administration and the route on the body. Other thing that we will like to discuss is the measure of energy input and loss that sometimes we can't preview. And in classical pharmacological studies, there are already defined methodologies for studying drugs pharmacokinetics. And the last point, it is the variety of equipment, because each country has different equipments, laser equipment, so it's really hard to standardize some protocols, because each country has a different equipment.
Hello, my name is Cássia Fukuda. I'm from Brazil, from All Laser. And this is a very interesting case about the use of a transthoracic photobiomodulation using a class 4 laser and ELIP, a transdermal laser, in the carotid artery in a patient with COVID-19. So we know that COVID-19 is a really pandemic situation all over the world. And what we have here is a case report of a man, 54-year-old, with no comorbidities. He had no signs of disease. And he was presented to the emergency department for shortness of breath, fever, cough, and oxygen desaturation, approximately 84%. So there was an image of the CT, computerized tomography, that showed the diffuse bilateral patch infiltrates with those ground glass opacities, really characteristics of COVID-19, and bronchial ectasis, comprising more than 75% of his lung. Then the diagnosis was COVID-19 by PCR. Inflammatory markers were elevated, and there was a peak of these markers on day 15 when the patient was intubated, and then laser irradiation was initiated. As you can see here by this image, you have the initial symptoms on day 1, and then we had an hospital admission on day 6, the ICU admission on day 7, and intubation at day 15. And finally, at day 34, we had the hospital discharge. And from day 15 until after the hospital discharge, we used laser transthoracic and also at the carotid artery. Right below that, you have the PCR evaluation where you can see the date, the follow-up that the PCR went like from 1 to 1.5 until 11.3. That was the day of the intubation. And concerning our methods, we used a laser class 4 on the day of the intubation, and we used parameters from 650, from 900 wavelength nanometers, frequency from 200 to 10,000 hertz, average power of 6 watts, and we had a total energy of 1,440 joules for 4 minutes. How did you do that? We took the thorax of the patient, divided in 4 parts. In each part, we irradiated 4 minutes. That is, the whole treatment for the thoracic part was 4 minutes, 16 minutes. And for the carotid part, we did 10 minutes. So 16 plus 10, 26 minutes approximately of treatment. And here you can see the pictures on the right side of our poster that we are demonstrating at this patient, the transdermal ELIP carotid artery being irradiated from 10 minutes.
My name is Barbara, I'm from Brazil, and I'm going to present a poster about the benefits of photobiomodulation in recovery of smell and taste in patients after COVID-19 infection. Many patients who were infected by COVID-19 persist with changes in taste and smell. Photobiomodulation, PBM, has been used for the treatment of taste alterations, xerostomia, and nervous tissues recovery, and may be an alternative of recovery of patients with post-COVID alterations. This work aims to evaluate the benefits of local and systemic photobiomodulation in recovery of taste and smell in post-COVID patients. 20 patients who, after the contagion period, remained with changes in taste and smell were selected. The time between infection and treatment with PBM was variable. Patients were divided in 2 groups. Group 1, local PBM plus systemic transdermal laser irradiation over the radial artery. And group 2, local PBM only. Up to 10 sections were healed. The gustatory and the olfactory perceptions of the patients were evaluated using a scale from 0 to 10. PBM acts in regeneration of nervous tissues as well as an inflammatory alteration that locally affect the taste of olfactory cells. Loss of the taste and smell caused by local inflammatory change recovery faster with photobiomodulation than those caused by neurological change. Loss of taste and smell caused by neurological alterations may not recover spontaneously, as we know. That may be a chronic neuronal injury. However, through the results presented, we proved that photobiomodulation can reserve the process. The use of systemic laser therapy, ILIP, accelerates results, and later you start the treatment, the longer the results will be. PBM proved to be effective in the treatment of taste and smell alteration in post-COVID patients.
My name is Sharon Ben Yehuda, and I will present to you today two studies that were conducted to demonstrate the effect of PBMT on inflammatory bowel disease models in small and large animals, mice and pigs. In both studies, inflammatory bowel disease was induced using dextrans sodium sulfate in the drinking water of the animals, DSS, and it creates an ulcerative colitis model, and PBMT was applied transanal for treatment. The inflammatory bowel disease, or IBD, are chronic intestinal immune-mediated diseases that are mostly Crohn's disease and ulcerative colitis. IBD pathophysiology involves genetic, environmental, epithelial, microbial, and immune factors. Currently available medications are used to reduce the intensity of the flare-up and prolong the remission periods between flare-ups. There are no non-medications treatment for IBD, and therefore PBMT is a very innovative treatment. Medications usually include anti-inflammatory drugs, steroids, immunomodulators, and biologic therapies, and all of those are associated with significant short and long-term side effects. Therefore, bringing PBM treatment into the intestine for the purpose of mucosal healing and anti-inflammatory actions to treat IBD is expected to be a much safer option and with significant few side effects compared to current IBD medications. In both studies that we have conducted, acute DSS colitis was induced in mice, 150 mice in a blinded placebo-controlled study. The PBMT was applied to the colon utilizing a small diameter endoscope with a lead-based light source at 850 nanometers using several doses. And dose was controlled by changing exposure time. Disease activity was scored endoscopically and also histologically in an histological assessment. In the pig study, acute DSS colitis was induced prior to treatment and followed by 6 treatment sessions to the colon over a period of 2 weeks using LED-based 850 nanometers capsule that was connected to a rectal tube. So in both cases, the treatment was given transanally. The treatment was provided to a limited predefined section in the pig.
Hello everyone, welcome to PBM 2021. This is Professor Chandrasekhar Yavgal joining you from Rajiv Gandhi University of Health Sciences, India. And today I'm here to present my poster on a comparative histological evaluation of the effects of laser photobiomodulation on dental pulp cells. So basically, I'm a pediatric dentist, and for pediatric dentists, pulpotomy is a very common treatment modality that is rendered in children. So it's a very big deal for us, and pulpotomy is the complete removal of the coronal portion of the dental pulp, followed by the placement of a suitable dressing or medicament that will promote healing and preserve the vitality of the tooth. This is more than 100-year-old science, ladies and gentlemen. Unfortunately, for more than 100 years, we have been subjecting tiny innocent children to certain harsh pharmaceutical pulpotomy medicaments such as Formoterol. Why do I say that? They are harsh, caustic agents because their carcinogenic and mutagenic potentials have always been questioned. So for far too long, we have been searching for the holy grail as well as far as pulpotomy in children is considered. Slowly but surely, because of photobiomodulation, we seem to be moving from a pharmaceutical era to a photoceutical era. So this is the first intervention of its kind where we have tried to accomplish pulpotomy by using a non-pharmaceutical fixative or a non-pharmaceutical agent, which is light. So how did we plan this trial? This trial, as you can see on the left-hand side of the poster, was divided into 3 phases. We did the first histological evaluation as an animal trial. Then, based on the encouraging results that we got, we did a human clinical trial and also followed up by a radiographic evaluation of those human pulpotomies done on children. So in the first method, we did the histological evaluation and we got very good results. You can see on the screen that when you compare laser photobiomodulation with Formoterol, the laser group.
My name is Matheus, and I will submit my project about evaluation of the effects of photobiomodulation therapy on pain relief in low back patients. Low back pain is one of the main causes of reduced quality of life and disability. Also considered the main cause of disability worldwide. It's estimated that low back pain affects about 12% of the world population, and that 38 to 84% of adults will have low back pain through their lives. And to investigate the effects of photobiomodulation therapy, PBMT, with the Lip Sports Pod device in chronic low back pain relief. 72 volunteers were recruited and randomly allocating two experimental groups according to the type of therapy, active phototherapy and placebo phototherapy. The total time of phototherapy application was 10 minutes. 15 minutes after the last PBMT session, the degree of pain classification, visual analogic scale, and the range of motion in the lumbar region was evaluated. 7 days after completion of treatment with PBMT, the volunteer returned to the laboratory so that the assessment of the degree of pain classification, VAS, could be carried out and the range of motion measures of the lumbar spine could be performed. Results. The values obtained through the VAS on the intensity of low back pain demonstrate that in the 5 moments evaluated after the treatment, there was a statistically significant decrease in pain in the participants of the group that received active PBMT compared to the placebo group. And this graph though shows the VAS at different evaluation time, and we can see that active phototherapy has a significant improvement in the pain when compared to placebo phototherapy. Thus, PBMT is effective for decreased chronic non-specific low back pain over a 3-week treatment period, with a continuous improvement over the subsequent 7 days with no added conventional treatment or medication. And in thanks to Multirations, Medical, FAPESP, CNPq, e LABT. Thank you.
Catherine Buriga, and I'm going to present you this poster entitled "Could Photobiomodulation Prevent Oxaliplatin-Induced Neuropathy?" We know that oxaliplatin is a cytotoxic and an antineoplastic chemotherapy, which has a place of choice in therapeutic strategies in many digestive cancers, especially. But even when it is active against the cancerous disease, we are leading to stop it because of its limits if it is limited of the neuropathy. So prophylaxis of oxaliplatin-induced peripheral neuropathy has been the subject of several scientific hypotheses based on pathophysiological mechanisms. Let me show you in theory what is the mechanism of oxaliplatin in inducing neuropathy. It induces mitotoxicity, which it produces reactive oxygen species and nitric oxide. It produces lipid peroxidation, so it leads to oxidant stress. In another hand, it also produces cytotoxin as TNF-alpha and interleukin-6, which leads to inflammation. On the other hand, we have photobiomodulation. We know that the light absorbed by the mitochondria induces ROS and NO. It reduces it. It acts against oxaliplatin, and it inhibits inflammation because it inhibits, it reduces the productions of some prostaglandin. So starting from this theory, we performed an experiment. First step, we were able to make a nurse cell culture. Then we divided our cell into 3 groups. The first group is a control group. We do not make any intervention for this group. The second one is a group exposed to only oxaliplatin alone. And the third group is the group who was exposed to oxaliplatin and then to photobiomodulation at 630 nanometer red waves at 3 joules per centimeter cube. Then we record the biological effect with the microscope called NanoLife technology because it allows us to observe it in 3D images over 7 days, the maximum possible of duration for the cell groups. So this experiment had not really take place because I didn't have the NanoLife technology, a microscope yet, but I know that it is possible. So we measure biological effect, and at least the last thing I want to show you is how is this
NanoLife
microscope
imaging
works.
is the only system that can image mitochondria without the use of markers or staining. Due to the high refractive index sensitivity of this microscope, the mitochondrial network can easily be distinguished at high resolution. You can see here the fine details of mitochondrial dynamics, including events of fission and fusion.
Recently, a patient came to me with low back pain, and it turned out she also had COPD. She was wheezing heavily on her entrance to the clinic. She had a very untoward pulmonary capacity, which had been measured a few days before her visit to 25%. And after the first session, she already felt a good improvement. And after 5 sessions, she was able to come up the stairs without a pause. After 13 sessions, her breathing was normal during the treatment. She had been given a diagnosis of being on the threshold of oxygen treatment before this session. And I called her a couple days back, about 1 month after the end of the treatment, which is 13 sessions, and she was still doing fine. And think of that, a COPD patient that had been close to the threshold of oxygen therapy, who is now being able to do things she hadn't been able to do before. She could dress and undress herself without assistance. She could eat her food without assistance. She could go into the garden and do a bit of garden work, which was unheard of before my treatment. I was very, very pleased to be able to help her. And the implications of this for healthcare systems are enormous. Think of the billions of dollars spent in treating COPD patients every year. And if this can be ameliorated, if this can be reduced in any possible way, that of course would be a great boon to healthcare systems and of course to the patients. My work with this is being published soon in a case study about this patient, and I will be happy to discuss this with anyone that is interested in learning more about how this is done. The patient was treated with adjacent probe emissions from the back and the side and the front. And this was all done in about an hour session, which lasted for each time she was here. I'm very happy to be able to present this and we'll look forward to your.
Thank you for participating in one of the best photobiomodulation conferences ever, PBM 2021. This conference is brought to you by the North American Association of Photobiomodulation Therapy, NORT, and the World Association for Photobiomodulation Therapy, WORT. Have a wonderful year and see you at the next PBM conference.